Scan 9-1, positioning the patient for basic life support. Step 1, straighten the legs and position the closer arm above the patient's head. Closer arm. Grasp under the distant armpit. Cradle the head and neck and move the patient as a unit onto his side. Cradle the head and neck and move the patient as a unit onto his side. 4. Move the patient onto his back and reposition the extended arm. This maneuver is used when the rescuer must act alone. Two procedures are commonly recommended for opening the airway: the head tilt chin lift maneuver and the jaw thrust maneuver, the latter being recommended when head, neck, or spine injury is suspected. Figure 9-4, head tilt chin lift maneuver, side view. Inset shows EMT's fingertips under the bony area at the center of the patient's lower jaw. Note, if any indication of head, neck, or spine injury is present, do not use the head tilt chin lift maneuver. Use the jaw thrust maneuver instead. Remember that any unconscious and many conscious trauma patients should be suspected of having an injury to the head, neck, or spine. Head tilt chin lift maneuver. The head tilt chin lift maneuver uses the head position to align the structures of the airway and provide for the free passage of air. By moving the jaw in an anterior fashion, the tongue is drawn forward, clearing the airway, and with it, the tissues of the larynx are moved off the glottic opening. To perform the head tilt chin lift maneuver, follow these steps. 1. Once the patient is supine, place one hand on the forehead and place the fingertips of the other hand under the bony area at the center of the patient's lower jaw. 2. Tilt the head by applying gentle pressure to the patient's forehead. 3. Use your fingertips to lift the chin and to support the lower jaw. Move the jaw forward to a point where the lower teeth are almost touching the upper teeth. Do not compress the soft tissues under the lower jaw, which can obstruct the airway. Do not allow the patient's mouth to be closed. To provide an adequate opening at the mouth, you may need to use the thumb of the hand supporting the chin to pull back the patient's lower lip. So again, to provide an adequate opening at the mouth, you may need to use the thumb of the hand supporting the chin to pull back the patient's lower lip. Do not insert your thumb into the patient's mouth to avoid being bitten. Figure 9-5, jaw thrust maneuver, side view. Inset shows EMT's finger position at an angle of the jaw just below the ears. Note, the jaw thrust maneuver is the only recommended airway procedure for unconscious patients with possible head, neck, or spine injury and unknown mechanism of injury. The jaw thrust maneuver. The jaw thrust maneuver is most commonly used to open the airway of an unconscious patient with suspected head, neck, or spine injury and unknown mechanism of injury. Note, the purpose of the jaw thrust maneuver is to open the airway without moving the head or neck. Follow these steps. 1. Carefully keep the patient's head, neck, and spine aligned, moving him as a unit as you place him in the supine position. 2. Kneel at the top of the patient's head. For long-term comfort, it may be helpful to rest your elbow on the same surface as the patient's head. Carefully reach forward and gently place one hand on each side of the patient's lower jaw at the angles of the jaw below the ears. Stabilize the patient's head with your forearms. Using your index fingers, push the angles of the patient's lower jaw forward. Using your index fingers, push the angles of the patient's lower jaw forward. You may need to retract the patient's lower lip with your thumb to keep the mouth open. Do not tilt or rotate the patient's head. In addition to physically opening the airway with the head tilt chin lift or the jaw thrust maneuver, it is imperative that the airway also be cleared of any secretions, blood, or vomit. The most effective way to clear the patient's airway is with a wide-bore, ridge-tip Yankauer suction device. It is crucial that the suction unit be ready for immediate use when opening and maintaining the airway. The equipment and techniques used for suctioning will be discussed later in this chapter.